Hello, and welcome to the Walrus Talks at Home, the Health and Climate Crisis. I'm Jennifer Ollett, Executive Director of the Walrus, and we are thrilled to be joining you online, bringing people together across the country and beyond, live in conversation. I'd like to start by acknowledging the land that I'm on in Toronto, Ontario, Canada, Toronto. A land acknowledgement helps us recognize history, thinking about how it informs where we are now and what changes can be made going forward, and a commitment to reconciliation. Our offices at the Walrus are within the bounds of Treaty 13, signed with the Mississaugas of the Credit. This land is also the traditional territory of the Anishinaabe, the Haudenosaunee, and the Wendat peoples. Today, Toronto is home to many diverse First Nations, Inuit, and Métis peoples. We're honored to contribute to a tradition and history of storytelling, and we welcome you to take a moment to reflect on the land that you're on, wherever you're joining us from today. As part of the ongoing work of reconciliation, if you haven't already or done so recently, we encourage you to read the 94 calls to action recommended by the Truth and Reconciliation Commission. A bit more about the Walrus, and this is where I pull up my prop. The Walrus turns 20 this year, and we are celebrating 20 years of Canada's conversation, taking a look at who we are now. You can find our stories wherever you're looking for stories, online at thewalrus.ca, in print on newsstands, or by subscribing to The Walrus. You can also listen to our podcast or be a part of public events like this one. And this work is powered by our donors, our partners, and our supporters. Thank you all for being here, and special thanks to the Canadian Medical Association, the Canadian Nurses Association, and the Canadian Public Health Association for making this event possible. Tonight, we're here to talk about something that's very important to us all, something that we are feeling more and more, and it's the health and climate crisis. The intersection of climate change and health in Canada is an urgent concern. As temperatures rise, Canada is witnessing an increase in heat-related illnesses and worsening air quality. I know many of us, near or far to the wildfires, have experienced this. In vulnerable populations, this includes Indigenous communities and those in northern regions, face disproportionate health risks. The Lancet Countdown on Health and Climate Change is an international research collaboration that independently monitors the evolving impacts of climate change on health, as well as the emerging health opportunities of climate action. In its 8th iteration, the 2023 report was released last week, and it draws on the expertise of 114 scientists and health practitioners from 52 research institutions and UN agencies worldwide to provide the most comprehensive assessment yet. Big brains involved and big brains on the talks this evening. We will be hearing from 5 contributors to this report. Now, here's how the Walrus Talks at Home works. Each speaker has 5 minutes for their talk live, and we go back to back. And this is followed then by a moderated Q&A session with the speakers and our audience, you at home. So at any point, feel free to ask your question or share a comment in the comments. We also encourage you to take a picture of however you're joining us, or if there are any moments that really speak to you, to tweet them out, or I think it's called X them out now, post them on social media. You can tag us at The Walrus or use our hashtag Walrus Talks. Tonight, we'll be hearing from live Dr. Harry Kennard, Senior Research Associate, Center on Global Energy Policy, Columbia University. Dr. Claudel Desrosiers, family doctor, co-lead author, Lancet Countdown Canada Policy Brief. Dr. Courtney Howard, emergency physician, vice chair, Global Climate and Health Alliance. Dr. Maya Kalogirou, PhD, registered nurse and representative for the Canadian Nurses Association. And Dr. Kathleen Ross, President, Canadian Medical Association. Thank you all for being with us for such an important conversation. And we're going to kick things off tonight with Dr. Harry Kennard. Hi, Harry, over to you.
Thanks very much, Jennifer. Very happy to be here with everyone. I'm coming to you not from Canada, but slightly south as Jennifer mentioned, the great city of New York, but very happy to be with you folks tonight. So I'm going to talk to you a little bit about the Lancet Countdown, and which Jennifer mentioned is now in its 8th iteration. So we have a big international collaboration, 52 different organizations, UN agencies involved. And what we aim to capture is the we work across 5 different working groups. So we have, these aim to capture the fundamental relationships between climate change and health. And the project was started as a sort of a means of drawing attention to this issue. So way back in, I think it was 2009, there was a commission that the Lancet undertook. And for those of you who don't know, the Lancet is a medical journal. And it's considered to be sort of one of the foremost journals in the world. And it was shown that the issue of the potential impacts and, as we now find, the actual impacts of climate change on our health was seen to be a really important issue, and needed some further sort of coverage in the media, especially, and also as a repository for sort of the leading science in this field. So, as I mentioned, the countdown, which I think you can access through the link that's been posted in the chat, now in our 8th iteration, across 5 different working groups. So I'm going to talk to you a little about what each of those working groups cover, and then hopefully get into some of the sort of headline findings from this year's report. And then we'll pass over to the other speakers who will talk more about the specific Canadian context. So I'm going to speak about the global context. I should say that I've been involved with the Lancet Countdown for the last 4 years. I think this is my 4th report now. I work on Working Group 3, which you will see in a second, is the mitigation and health co-benefits working group. So the first section of the report really focuses on the direct health impacts of the changing climate on our health. So that immediately brings to mind increasing temperatures. So I will just scroll down here to my stat. So we the most sort of salient aspect of the relationship between climate change and health is the increasing heat and how that affects vulnerable populations. So if you bring up the report, you can see this in more detail, but the headline finding is that there is a huge increase in the number of people who are exposed to dangerously high temperatures, especially amongst children and newborns, and then also into older vulnerable populations. So that's just one example of that direct health impact. In the second working group, that looks at adaptation and our sort of attempt, I suppose, as a society to cope with some of these changes that are we're going through. In that context, so we're thinking about things like how much funding is going towards adaptive measures, and there's specific focus on the healthcare sector and how much funding healthcare sector receives. In terms of the context there, I mean, the global economy, as many will know, is $100 trillion. And the fraction that we spend on direct health-related mitigation actions is absolutely minute. It's sort of in the hundreds of millions of dollars, which, you know, sounds like a lot of money individually, but globally, when we think about the problem, that is really not enough. So then on to the working group 3, which is the working group for which I'm a principal author. That tracks the relationship between mitigation actions and health. So that's anything we do where we try to reduce carbon emissions and the health co-benefits of doing so. So a really clear example is air pollution, and we'll hear a bit more about that in the Canadian context. So if we shift away from incredibly harmful fuels like coal, which have very significant air pollution impacts, that will not only reduce carbon emissions, but also extend lives that are currently cut short through the particulates that are emitted when we burn coal. There are other health co-benefits associated with shifting diets. So if we move away from very high carbon intensive meat production, so red meat, especially beef, is, while it may be delicious, it has a very significant climate impact, and shifting away from excess consumption of that will have one of these, co-benefits where we reduce emissions and also help health. So it's a sort of a good news story, or at least the potential for good news in that working group. Working group 4 looks at the relationship between climate funding and the economic impacts of the relationship between climate change and health. So there, for example, I will just move down to my statistic on this. Bear with me 1 second. So that's sort of increasing the availability of climate finance to promote a healthy, just transition that will have a significant impact on the relationship between climate change and health. And then finally, just before I pass over to the next speaker, the final working group that we have convened looks at the media engagement with this issue. So this is part of the sort of process of assessing whether we were having impact in the world. And you can see some very significant uptick in the amount of media coverage that this issue gets, which is essential if we're going to do something about it and build consensus to be able to move towards a fossil-free world where we maximize our health. I think that's just about my 5 minutes up. So I will pass over to Claudel, as if by magic. Thanks.
Thank you, Harry. Hi, everyone. Good evening. My name is Claudel Desrosiers. I'm a family doctor and associate clinical professor at the Faculty of Medicine of Université de Montréal. And for the last couple of years, I've been fortunate enough to collaborate with the Lancet International team as a co-author of the Canadian policy brief. Our political briefs aim to translate what science is telling us into real concrete policy asks that can meaningfully and positively impact people's health across the country. We believe that doing so will help shape a healthier response to the big and complex challenge that is climate change. I work as a family doctor in Montreal, in a district that has its share of social ecological injustices: poor air quality, lack of green spaces, industrial pollution, road traffic, and difficulty to access to high quality and fresh food. The people that I'm called to care for are among some of the most vulnerable in the face of climate change. So what we cover in our briefs every year is very concrete to me, as it's something I deal with on a daily basis in my clinic. And especially this year, as we've looked into adaptation to extreme weather events and sustainable food systems. We've known for many years now that climate change is the biggest threat to health of the 21st century. The impacts we know will be felt on every single one of us, but even more unequally felt by the most vulnerable and on the ones who have contributed the least to the crisis. However, the good news is, and we know that from science, is that acting on climate change is actually good for our health. It offers us an opportunity to improve people's health directly, for instance, by improving air quality and to decrease growing health inequities. My hope in doing this is lie right there, is that we know that as health professional, what we want is to create a healthier world, and tackling climate change actually offers us that chance. And this also what has guided us in this writing of this year briefs. My colleagues, Dr. Courtney Howard and Maya Kalogirou, will go deeper in some of the content of the brief, but I'll take this opportunity right now just to highlight a few elements. As you know, many of us across the country have had a difficult summer. Some cities, as in Montreal, has experienced simultaneously smoke and extreme heat. It's a deadly combo, and it has endangered people's lung, people's heart, people's brain. Entire communities and hospitals have been evacuated in several provinces and territories, adding pressure on some already severely strained healthcare systems. Current assessments put us on track for a 3 degrees warmer world by the end of the century. And in some part of the country, we expect average temperatures to even increase by up to 7 degrees. Our adaptation capacities may soon reach their limits, and this highlight even more than ever the urgency to transition away from a fossil fuel-based economy and to reduce our emissions. And this needs to happen today and at a much quicker speed than what we've seen happening in the last couple of years. Especially in Canada, I think we need to stop subsidizing the fossil fuel industries, and government policies must direct funding and investment, including one of the big banks, toward renewable and efficient sources of energy. Our second set of recommendations in this year briefs tackle our response to extreme weather events, such as wildfires. About 2 years ago, our policy brief put forward a recommendation on the need to develop a national adaptation plan. This policy ask has been heard by the federal government, and we're happy about that. And so we have now a national adaptation plan on the federal level. However, what we've noticed is that the last couple of years have shown us that we need to allocate more resources to adaptation planning and ensure that the communities, especially First Nations, are fully integrated in a culturally safe way into disaster prevention and response planning policies. Finally, as I mentioned earlier, there are several areas in which climate action can result in clear benefits for health. And our third section of this year briefs focuses on one of these areas: the need to transform our food systems from the intensive agriculture practices that we have to the way we manage food waste. Our health will directly benefit if we shift towards less carbon-intensive diet. And we believe that hospitals and schools can lead by example by serving menus based on the principle of a planetary health diet. In short, and I will finish right here, is that addressing climate change provides clear benefits for people's health for today and of future generations. And I hope you will join us in framing climate change as a health issue, because science has shown us that by doing so, we help boost public support toward efficient climate policies. Thank you.
Hi, I'm Dr. Courtney Howard. I'm speaking from Yellowknives Dene territory, the traditional territory of the Yellowknives Dene and the North Slave Métis. So I'm an emergency physician here. This is the subarctic. As an emergdoc, I serve a patient population that extends all the way up to the high Arctic. It's an area the size of France and Spain combined. So this part of the world is warming at between double and quadruple the global average, depending on which part of the territory you're talking about. We've been severely impacted by wildfires. Lancet Countdown data shows that we're not the only Canadians who've had that experience. So between 2018 and 2022, as compared to a reference average that wasn't that long ago, it was right about when I graduated from medical school, we've now experienced over 2 days of exposure to very high or high wildfire danger, which represents a 116% increase just in those about 15 years. Meanwhile, our personal wildfire smoke exposure has increased by about 220%. Now, this has had major consequences for health and health systems. I don't know if anyone else has gone and stood in the parking lot of Fort McMurray Hospital, but I have, and you can see burned trees in 2 directions if you're standing there in the emergency department parking lot. They evacuated in a matter of hours without loss of life, which I consider to be just an absolutely heroic act. But this represents a really near miss of the sort that we do not want to have when it comes to hospitals. My own hospital needed to be evacuated this summer as well. It's a 100-bed hospital. We're not talking a little hospital in the middle of nowhere. We are a regional center that the whole North relies upon. And it took people from 2 provinces and a military evacuation operation to get our 100 people to safety. It was an over 1,000-kilometer evacuation. As part of that, 70% of the people in the Northwest Territories were evacuated. Now, we see from some of the early data that the greenhouse gas emissions from these wildfires have almost, what it says, has more than doubled Canada's planned cumulative anthropogenic emissions reductions over the next 10 years. And so what that means is that the actual greenhouse gas emissions emitted by these wildfires are starting to make it difficult for us as a country to have a net decrease in greenhouse gas emissions. This really underscores the urgency of the mitigation that Dr. Claudel Desrosiers was really highlighting. we need to make sure that we start to decrease greenhouse gas emissions through fossil fuel phase out and other measures as quickly as possible, because the thing is that just like human bodies depend on all of our organ systems to work well, and our heart needs to work in concert with our lungs. And when we go in there to the trauma room as an emergency physician, someone comes in unstable, we want to act as quickly as possible while all of the organ systems are still working, because if we give a medicine at that point, it actually works and we can bring the person back to stability. What we're seeing right now is signs of the earth system itself is starting to become somewhat unstable. We don't want to see what happens once her organ system starts shutting down and we start getting positive feedback loops. So as Dr. Ross starts to talk about how we can protect health and health systems, and we talk more about fossil fuel phase out and how we can decrease greenhouse gas emissions with regards to health systems, I just want to say thank you for this work that we're all going to do together from one of the parts of Canada that is most severely impacted, particularly one where Indigenous peoples who have done some of the least to produce some of these emissions that have caused the problem are being so very highly impacted. Thank you.
Hi, everyone. My name is Maya Kalogirou. I am a registered nurse speaking today on behalf of the Canadian Nurses Association. In 2018, my partner and I decided to visit Montreal. While we were there, we experienced a deadly heat wave that killed 66 people in the city. As a nurse, it is my job to promote human health. And seeing the devastating effects of this heat wave made me realize just how important it was to consider the climate crisis alongside human health. We know that climate change is a serious existential threat, but I also want you to know that there is still hope. There is still a small window of time where we can make the significant transformative changes necessary to limit the negative health and life-threatening consequences of climate change. Part of how we do this is by taking health-centered climate action. The policy recommendation in this year's brief for Canada that I'm about to share with you does this exact thing. The recommendation states, integrate a planetary health lens into education and health system food provision, and societally into food production, consumption, and waste. Support healthy, sustainable eating that is accessible, affordable, and culturally appropriate. Before we unpack that, let's go back in time. In 2015, Canada released the latest version of its food guide. It was a big step forward in that, for the first time, it emphasized plant-based proteins over animal proteins, and it even drew attention to the connection between the food choices we make and their impact on the environment. This was a significant achievement. However, the guide's recommendations are not yet widely implemented. The Planetary Health Diet is a food guide that considers food and climate impacts together. Research shows that Canadians are eating both red meat and dairy at levels higher than what the Planetary Health Diet recommends. While it is admittedly challenging to make blanket statements on per capita emissions around food, the Planetary Health Diet generally suggests that we should aim for under 0.5 tons of CO2 equivalent per capita per year. Due to our dietary habits, Canadians' average food-related emissions are over double this. Foods high in emissions are also often harmful to our health. Data from the 2023 Global Lancet Countdown Report show that in 2020, 30,000 Canadian deaths were associated with insufficient consumption of nutritious plant-based foods. The associated health burden of excess red meat and dairy consumption in Canada was associated with 17,000 premature deaths. In the same year, red meat and dairy still accounted for 60% of all emissions associated with the consumption of agricultural products in Canada, and 48% of all emissions related to agricultural production. When we view food systems from production, consumption, and waste from a planetary health perspective, our goal is to simultaneously promote high levels of human health and the health of our planet. In this year's brief, we call on hospitals and schools to take on this planetary health perspective with regards to the foods that they serve or should start serving. A wonderful example of leadership in the health sector comes from Nourish. Nourish is an organization that places an emphasis on local production, planetary health menus, and Indigenous foodways. Nourish has partnered with the World Resource Institute to bring the Cool Food Pledge to Canada. Hospitals that sign on to this pledge commit to reducing emissions associated with the food they serve by 25% by 2030. 5 major health organizations and 16 participating health facilities in Canada have signed on to date, serving 4 million meals each year. Schools are another place for leadership. Canada is one of the only industrialized nations without a national school food program. Offering a school food program that is centered around planetary health would support the planet and healthy child development. When children's brains are well nourished, they learn better, and this further benefits future health, our economy, and productivity for years to come. Finally, equity is key in shifting to planetary health dietary habits. Almost 1 in 5 people in Canada live with food insecurity. Fresh produce is prohibitively expensive for some households and some rural and remote communities. Increasing nutrition support programs for low-income households should focus on plant-forward and minimally processed foods. Indigenous traditional food sources are affected by climate change, yet traditional food offers nutritional, cultural, and spiritual benefits. So promoting Indigenous food sovereignty is another win-win opportunity to benefit both health and the environment. When we intertwine climate change and health, we start seeing numerous opportunities for positive change. By promoting the health of our planet, we inherently foster our individual and collective health. And this is a responsibility that we all share. Thank you.
Thank you, Dr. Kalogirou. I'm Dr. Kathleen Ross. I am very pleased to be here, and I want to thank the Walrus for hosting this important event and the Lancet and all their contributors for their work on this issue. This publication and conversation could not be more timely. So as you heard earlier, I'm the president of the Canadian Medical Association, but I'm actually also a practicing family physician working in the Lower Mainland in British Columbia. As my fellow panelists have made so clear, the evidence on the need to change has never been so apparent. As a family physician, my colleagues and I are witnessing firsthand the health impacts of climate change. And as we heard, climate change is a health threat multiplier for the most at risk. And this is including rates of respiratory and cardiovascular disease to climate anxiety. And I'll tell you that climate anxiety weighs particularly heavily on our youth. The climate change also impacts all aspects of healthcare through its effect on food security, as we heard, on housing, household economics, mental health, and chronic disease patients. And indeed, climate change is even shifting how and where healthcare is delivered. As you heard earlier, there was massive wildfire evacuations, and that impacted many neighboring provinces and territories as patients sought both shelter and care. And I can say that our healthcare system was really not prepared to cope with this emergency. My own hospital in the Lower Mainland supported patients from the Northwest Territories, and it was emotionally challenging for patients and their families to be treated so far from home and family support, but it also challenged the capacity of our local resources to meet the needs of our population needing acute care. This is all happening at a time when the healthcare sector is already under unprecedented strain, and that strain has and will continue to be made worse by the increase in climate change related illnesses and evacuations. And physicians and other healthcare workers are already stretched thin trying to keep this system afloat. And with record levels of burnout and many choosing to leave the profession altogether, we need to understand that the climate crisis is exacerbating the pressures on healthcare workers, both professionally and personally, as Dr. Desrosiers stated. But this summer, it was really driven home when many of my colleagues were evacuated and several lost their homes altogether. So if we know that this is a time when the health workforce, support has never been more critical, we need to recruit and train new providers for the future and make sure everybody in Canada can get the care that they need. We need to take this seriously. So physicians we know are already trusted voices in health and wellness, and healthcare providers can become leaders in strategies to improve the impacts of climate-related health and wellness issues. We can continue to increase and share awareness of a national adaptation plan and share what we learn with administration, colleagues, and more importantly, with the patients that we care for. So, how do you get started on such a monumental task? But perhaps it's by ensuring that healthcare professionals have access to the information and training we need to meet those challenges. And examples of adaptation could mean learning about more evolving diseases and disease processes on top of the best practice to treat illnesses that are being exacerbated by climate change. Modification to our foundational medical training model, as an example, CanMeds for physicians is on the horizon, but we'll need to put in place infrastructure and support for those already in practice to increase their knowledge. Of course, in all of this, we must remember that our health system itself is responsible for 4.6% of our total greenhouse gas emissions. And while that doesn't sound like a great number, especially compared with bigger, heavier emitters, think of it this way. If we took the most recent government numbers on Canada's total greenhouse gas emissions across every sector, healthcare systems accounted for 30.82 megatons of carbon dioxide equivalent, and that's more than aviation and shipping. And this makes us one of the worst healthcare polluters per capita in the world. It's really important that government, physicians, and other partners transition to environmentally sustainable and climate resistant health system processes, everything from reducing waste to rethinking our healthcare infrastructure. If we could remove that many emissions from our atmosphere, we would directly help to slow climate change and mitigate the impacts that we're trying to deal with. We would become more resilient in the face of extreme weather events, and disruption from climate-related events can certainly disable critical health infrastructure, as we saw this year, exactly when it's needed most. So I know we wanted to talk about a few practical examples. So at a practice level, we can learn and adapt to local climate risks and look for our resources, looking at sustainability on our individual practices and implementing such changes, relatively simple ones like eliminating exam room table paper, using LED light bulbs, leveraging virtual care to reduce greenhouse gases and transportation to get to care, utilizing sustainable energy wherever that's possible. We can educate our patients and provide more specific risk advice for chronic disease medications, particularly those with cardiovascular and respiratory illnesses, preparing them for wildfire season, the same way that we would for allergy season and cold and flu season. We can advocate for enhanced community level programs like cooling centers or free air conditioners for patients most at risk as part of the care plans that we put in place for patients. We also need to make sure that we're educating hospital administration and patients around the benefits of plant-rich diets, as we've heard already, and then role modeling these practices. We also need to improve access to healthcare via active transportation and ensuring that we support time in nature, better for our planet and better for our health. Sharing our own individual actions as role models does have an impact, particularly if we share steps we're taking to personally reduce our impact, decreasing beef intake, moving away from gas, reducing short haul flights wherever that's possible. And of course, physician advocacy for health system change is equally important, encouraging consideration of carbon impact and sustainability of our local hospital systems as we undertake quality improvement, increasing recycling, moving away from greenhouse gases that we use for anesthetics, medicines, medical equipment, taking a really close look at the carbon impact of our supply chain. And alongside that, looking upstream in our healthcare system to reduce the need for care in the first place. As an example, a healthier population via improved social determinants of health and screening for early disease prevention and management would help. Looking to such partners as choosing wisely to decrease unnecessary investigations and select more climate-friendly treatment. The most simple one I can think of is reducing meter-dosed inhalers in favor of dry powder inhalers. And healthcare providers advocating for climate change to be framed as a critical health issue would help to inform the general public better and accelerate the commitments we need from policymakers locally, provincially, and federally. Keeping green belts green, banning fossil fuel advertising, decreasing fossil fuel expansion in favor of sustainable energy resources are all examples of current physician-led advocacy, because we know action at all levels of the government is needed. It's to that end that the Canadian Medical Association is advocating for environmentally sustainable health systems in Canada, with a focus to reach net zero by 2050 or sooner. As part of this, we're calling on a national climate and health secretariat that would help effectively organize and develop a pan-Canadian approach to address the impacts of climate change and health while achieving Canada's climate commitments. This would certainly include supporting initiatives to create those climate resistant and low carbon sustainable systems across our provinces and territories. This includes building that climate resistant health workforce with enough staff, enough capacity, and enough planning to really address climate emergency. It is really critical in my mind that we work to reduce our carbon footprint and mitigate extreme weather events. And if we do, I too am hopeful that we can save thousands of lives and truly build a healthier population. Thank you.
Thank you, Dr. Kathleen Ross, as well, Dr. Harry Kennard, Dr. Claudel, Desrosiers, Dr. Courtney Howard, and Dr. Maya Kalogirou. Okay, we're going to start opening this up, and this is where we want to hear from you, our audience. Let's start with seeing who is joining us tonight. We love bringing people together in conversation from across the country. So you'll see a pop-up poll. Let us know where you are tuning in from. And it's great to see folks from Whitehorse. Hello. Thunder Bay, North Saanich, Sherbrooke. Hello, Sackville. Thank you so much, everyone, for being a part of this. Now, to lead our conversation in Q&A, I am thrilled to introduce our moderator, a good friend of the Walrus, André Picard, author and health columnist with the Globe and Mail. Welcome back, André. Over to you.
Thanks, Jen, and it's a pleasure to be here. It's quite an interesting conversation. I'm really keen to see what questions the audience have. I already have a few, and I'm going to jump right into them because we don't have too much time. So I want to welcome back our talkers. Join me on the screen by the magic of the internet, and we'll get started. Great, I see everyone's there, so we've got no tech problems. Harry, if I could, I want to start with you. You talked about some big picture stuff. You work on mitigation, you know, the world, but I want you to bring it down to the individual level, because a lot of the questions are about what can I do? So what's the single most important thing an individual could do to mitigate climate change?
Thanks very much, André. It depends a little bit on who the individual is, but assuming a sort of the average who I will, it's, you know, I don't want to make any sort of assumptions about who's watching this program, but I'll have to make some, I guess. One thing that I think is not very well understood by regular sort of everyday folks is the impact of buildings in terms of emissions. And that is especially relevant in Canada, where we, you know, the weather is cold and we have to heat our homes. And so globally, the picture there is that around a third of all greenhouse gas emissions are attributable to buildings. And that's a massive chunk. I think if you ask people what they might say, oh, flying is really important, or maybe they might know about diet. So if you have, and this is again where I sort of referring to the what capacity you have for an intervention. If you have the capability to think about how your home is set up in terms of your heating, that is an intervention that can be really powerful. So one really clear way of reducing emissions is shifting from natural gas heating to heat pumps. I can talk about this for hours, so I'll leave it there, but just in the interest of everyone else's questions. But that's the thing that immediately occurs to me.
Yeah, those are some good practical suggestions. And as you said, people don't always think about their housing, but it's a big contributor. Claudel, you talked about, you know, climate change does not impact everyone equally. Talked about vulnerable groups. Can you give us an example of a group that's affected disproportionately by climate change that we don't always think about?
There's so many. I think it's important to understand the variety of impacts that climate change has on health, so that we can address the vulnerabilities based on those impacts. So, and it depends if you look in Canada, in an urban setting, or across the world. And at different sort of lenses and scope, you have different groups of population that may be more vulnerable to climate change. So if I look, for instance, where we're downtown Montreal, in an area that is socially, economically disadvantaged compared to the rest of the city, obviously we have a higher rate of poverty, and we know that people with poverty tends to be more vulnerable in face of climate change. And if you look, for instance, for heat waves, we know that people that are over 65 are considered more vulnerable for different reasons, mostly because they tend to have chronic diseases, take many medications, and naturally our body with age loses capacity to regulate heat properly. So I think it's important to not assume that one single group is more vulnerable, but when we look at what we can do politically speaking, is that we understand those vulnerabilities and that they are incorporated in our policies. And I will just lastly say, I think in Canada, one of the groups, or I mean, I would say groups in plural that have been not adequately integrated into those conversations, are Indigenous people across the country who have been land protectors over centuries that know the ecosystem, that have witnessed changes on the first hand, and usually we tend to not listen adequately to their voices and their knowledge of the land. So again, I would go back to understanding how complex this is, but making sure that by understanding that, it means that we can tailor policies to the group so that everybody can be leveled up in terms of benefits of climate action.
Yeah, and Courtney spoke to that earlier, that the Indigenous communities are really disproportionately affected, especially in the north. I think you pointed out elders, that's a very important one. That's who dies during heat waves. So there are a lot of groups, and we have to pay attention to that. Courtney Howard, you mentioned earlier wildfires. I wanted to give a shout out to the book Fire Weather, John Valent. I know you know that book. It's somewhere on the shelf behind me too. Oh, you've disappeared to go get his book. Well, there it is. Yeah, so great about the Fort Mac fires, but about climate change more globally. But I want to ask you, you're someone who's been very passionate about this for a long time. Do doctors, do healthcare workers, do they have an ethical obligation to address climate change and not just treat people who are getting sick from it?
100%. We actually wrote a commentary in the Lancet a couple of years ago as a global group introducing a new Hippocratic oath for the Anthropocene that talked about the fact that as physicians, we're responsible not only for the patient in front of us, but to advocate for healthy public policy on behalf of them all. So when I went to medical school, I really thought that health happened inside the hospital. They didn't teach us a lot about the social determinants of health at the time, but I now understand it to really be happening within what I think of as a planetary health nest. So I think about the ecological determinants of health as being the foundation of that nest. Now, this house actually sits on permafrost. So I got to tell you, when you live on permafrost, you really take your foundation is an active participant in your life all the time. We have to get our house leveled on a yearly basis. And so when your foundation is stable, you have the opportunity to build housing systems, economic systems, and to staff, supply, and build our incredibly complex healthcare systems. When our ecological foundation starts to get unstable, we simply are not going to be able to provide a stable healthcare system. When you think about what it takes to keep a building functioning properly, to keep the air quality inside the building good in terms of bad smoke exposures, to make sure that the patients aren't exposed to extreme heat, to make it sure it's supplied with pharmaceuticals, with the medical devices we need. We saw during a bad hurricane season that almost all of the hospitals in North America ran out of normal saline because the one factory that supplies it was really hit by the hurricane. You start to understand that in order to provide not only healthy populations, but really highly functioning healthcare systems, like what we expect to have here in Canada, you need a stable ecological foundation. So we need to be thinking about all elements of that planetary health nest when we think about what is our responsibility as healthcare professionals.
Maya, you talked about, the healthy diets, sustainable eating. Should we all just be vegans? Is that the simple explanation of what you're telling us?
Well, I don't think it's that simple. Again, there's all of these, food is such an important part of our lives, and there's all of these cultural aspects to it. And it's not about everybody going vegan immediately. I think I like to think about it as balance. I think our diets have largely become unbalanced. And, again, you look at the Canadian Food Guide and you see we need protein, but it doesn't have to come from meat. And so a term that I think, I talked a lot about plant-based in my, my speech, but what we'd like to really think about is plant-rich. It doesn't have to be a zero meat or animal product diet, but it does have to be balanced, and it does have to be sort of in context of like, what's your food habit like in general? Because again, for different cultures and different people, meat is a part of that. And, there's a big cultural aspect there that is important to also appreciate and, just kind of keep in our minds, I guess.
And the other aspect of this is, it's how we eat, right? Like I walk through sidewalks crowded with people delivering food in plastic containers. That's an issue as well.
Yeah, I mean, it's like the food we eat and the processes around it, again, from production, how we eat it, where we eat it, who we eat it with, it's changed. It's really different.
And Kathleen, you talked about, treating patients, eco-anxiety being a big issue for young people. How do we treat that? Do we treat it with CBT, or do we treat it by creating a better planet?
Yes, I think that's very true. No, it is important that we acknowledge the anxiety that particularly our youth are experiencing, and then to model and share what they can do individually and how they can learn more and spread their knowledge. I'm a big believer in grassroots and community-led engagement, and some of the things that we look at as we continue to modify our response to climate change are community-based. Tree planting, gardens. In our own hospital, we have a herb garden in our mental health and substance use building that acts as both a wellness initiative for patients, but actually also provides some healthy food in the hospital. So for counseling, yes, encouraging youth to be active, use their voice, feel empowered, because many of them don't feel empowered, is part of this challenge. And then, as I mentioned earlier, really role modeling. What are we doing to change our footprint as healthcare providers? Things that we can share with, with leaders in the government. One of the questions in the chat there was about what are specific, tangible actions that we can ask for legislators to actually move forward in, and tracking and understanding the carbon impact of our supply chain in healthcare. Is something that we should be looking closer at. We should be looking at how we provide food, how we power our hospitals. It's easy to say that we want to move to sustainable energy sources in our facilities, but if your electricity is powered by burning a fossil fuel, that might not be the best way to make that shift. We need to have an understanding of where we're at now, and put in place regulations that encourage that shift to renewable energy. Long-winded answer for a short question, sorry.
Harry, I want to, in fact, ask you that question that was put in the chat. How do we bridge that gap? There's a lot of good evidence. You just have to read the Lancet countdown. The evidence is there. How do you get the policymakers to act?
It's tough. I think there's an element, there's probably two things. One is trust, which the transition to a sort of, low carbon world really is, there's a phrase where it's going to be limited by the speed of trust. And for the legislators who do not currently engage in this process, they are most likely representing interests in the democratic sphere that it's not in their best interest to move away from fossil fuels quickly. That doesn't necessarily mean that the concerns of those communities aren't legitimate. I mean, you have to think about the livelihoods associated with fossil fuel production, let's say. I mean, that's very relevant for Canadian provinces, Alberta and the like, where there will be a lot of people who rely on those jobs. That said, engaging with them in a way that allows them to see the sort of incredible strength of evidence that shows that we need to be doing something very, very quickly about this problem is really the way to break through that impasse, in my view.
And Claudel, could you build on that? How, it's easy to say we should get away from fossil fuels, but it's part of people's lives. How do you make them make that big change? And how do you get the politicians to encourage it?
I think one thing we haven't been good at is at measuring the health benefits from the ecological transitions. Just in Canada, we know that air pollution kills 15,000 people each year, and the cost for healthcare is about $120 billion a year. So by reducing air pollution alone, this is the money that we can get. And so I think it's important to consider those health benefits when we discuss in terms of finances and investment and fundings, because obviously it can look from some perspective financially heavy to invest in the just transition. But when you integrate the health benefits and the health improvements, suddenly you're not looking at just funds that you're going to spend. You're looking at monies you're going to get back. And so I think we need to have more quantification of those benefits, and we're starting to have them because of health professionals across the country who've said it's important that we do that. So it goes for policymakers, and in my experience is that when you do present them with health arguments and you say you reduce mortality, you reduce the number of people going to your ER, you're going to reduce the numbers of people that are going to get sick from heat waves, it speaks to politicians, and it helps people to reduce this psychological distance that sometimes we have towards climate change, and it brings climate change to something very close to our heart and to our values. And health is one of the most universal values out there. And I think by using that and by fueling our arguments for the transition using healthcare and health perspective, and science has shown that there's been studies on climate communication from a health perspective, but it's more efficient than by talking only economic or ecosystems or animals that are going to be impacted by climate change. So I think there's an opportunity there that we haven't used enough in the last couple of years, and the Lancet is providing us some data around how we can better use that. And I think it's our job as health professionals, but also as individuals, to speak to our politicians, policymakers, and making sure that when we discuss climate change, health is part of that discussion too.
And Courtney, there's an interesting question in the chat about what are the missed opportunities in Canada? What do you wish the politicians had done that were the low-hanging fruit, the easy stuff that we haven't done?
Come on, André, easy stuff. I think it'd be pretty easy to put a cap on oil and gas emissions. That's
even
what we
in a country like Canada that depends a lot on fossil fuels, the whole Alberta economy, et cetera.
I don't think we're doing our population a favor by failing to deliver them honest information. So when you look at the International Energy Association and their projections, they're projecting a peak in oil and gas use before 2030 and then a decrease. Meanwhile, when we look at what's happening in Alberta right now, we saw record profits from fossil fuel companies, which, by the way, we are still subsidizing with our taxpayer dollars. And meanwhile, those companies were not reinvesting in projects in Alberta. They were giving those dividends to their shareholders. So what we're seeing is that the companies themselves are seeing the writing on the wall, and they are not reinvesting in extraction from a resource that is likely to start to become less economically viable as prices go down. We know that places like Saudi Arabia are going to be able to take oil in particular out of the ground at very low prices for a very long time. Canada is at risk of having one of the reserves that is left in the ground first. And so when I think about what that means for my patient population, we're downstream from the oil sands. I know it seems weird, but the water actually goes north. And so we have tailings ponds that are now twice the size of the city of Vancouver upstream from us. And we're starting to see a narrative from the fossil fuel companies that says, climate change is so bad that actually, how about we sort of minimally treat these and just put them into the Athabasca to go and pollute one of the world's great freshwater systems right near the end of the age of fossil fuels. That is a tragedy. So as doctors, it's often our job to go into a room and give people information they don't want to hear. It's one of the most difficult parts of the job. When I see something on an X-ray that looks like it might not be pneumonia, but might in fact be cancer, I have to go in there and prepare myself and say, hey, we saw something, it's worrisome. We're going to need to do follow-up results. Here's the plan. It's tough for us, but as a patient, and I've been on that side of the bed as well, you want to hear the real information because that's what's going to help you and your family set yourself up best to make a plan that's going to keep you safe and healthy into the future. So we need to be telling Canadians what's happening. We need to be helping them figure out, okay, well, should I retrain? What should I ask my child to do when they graduate from high school? What's going to set them up for a lasting economic future? And that's what we need from our politicians. Right now, our greenhouse gas emissions, we're not hitting our targets. It's largely because of increasing oil and gas reserves or oil and gas emissions. And we're leaving a big giant mess for future generations. We can do so much better than this. And sometimes it's just really required to give an accurate diagnosis, give the tough news, and make a plan, because that is actually what's going to help and keep us safe and healthy into the future.
And Maya, can you build on that? As Courtney said, these are sometimes conversations people don't want to hear. How do you engage the public in something that's not necessarily something they're enthusiastic about?
Yeah, I guess I'm glad you asked me that question, because as a nurse, we are one of the most trusted professions time and time again. And I think that there is a really important piece here, at least, if you're asking me as a professional, what is my role? It is to use my trusted voice to be that liaison with people and to help them understand the real health risks, that they are facing. And so how do we work? Nurses are working with people and populations out in the community, in hospitals. We're everywhere, and so I really feel like we have this ethical duty to advocate for climate, healthy climate choices and policies, and whatever that looks like, whatever that means. So it's really great, at least from that professional perspective, if that's what you're asking. If you're asking from a personal perspective, that might be a slightly different answer.
Okay. Now we're almost out of time. I always like to end a panel on a hopeful note. So I want to ask each of you to say one thing that gives you hope that we're going to tackle climate change. Just one sentence. What's the one thing that gives you hope? Kathleen, I'll put you on the spot first.
Actually, I love ending on a high note, as you know, but I think that we're in a really critical time right now where we're starting to share responsibility on gigantic problems that are facing our health and wellness in Canada. And framing this as a health and wellness issue should drive change. And we know that governments are listening now on all issues related to health and wellness of Canadians. It's a great opportunity.
Harry, do you have a hopeful note to end on?
I do. Something that's happened in the last sort of two years is that now people are seriously talking about peak fossil fuels as happening within the next 10 years. It won't be quick enough, in my view. It's not quite as rosy a vision. It won't be quick enough to avert the most sort of the beginning of the issues at sort of 1.5 degrees. But the fact that we're talking about peak emissions is good.
Great. Claudel, can you be hopeful?
Yeah. About 30 years ago, we've managed to restrain one of the most harmful industry out there. It was the tobacco industry. We've regulated, we've put on restriction, we've put regulations, and tobacco use in most countries has decreased, and health of people have improved. And I think we can do that exactly, but with fossil fuels, because we've done that in the last couple of years with tobacco industry. And for me, those two players are similar in their tactics and the way they engage in government. So if we've been successful in the past, I think we can be successful again.
And Maya, I think you've been hopeful all throughout. This should be easy for you.
Yeah, I think my sentiment is pretty short. It's that we can do this. We can do this, and we have to do this. And it's when we start believing that it is impossible that basically industry wins. And so we need to continue to work together, try to connect with one another. There is strength in numbers. If you're a nurse, join the Canadian Association of Nurses for the Environment. If you're a physician, join the Canadian Association of Physicians for the Environment. Find your people who are passionate about these things and make waves, because that's the only way things will change.
And Courtney, last word, what's the one thing keeps you hopeful, keeps you going?
Some of us have been working on this for a long time, but we're now starting to see the entire health sector coming in. So we're responsible for the allocation of 10% of global world product. Imagine that. So what we're seeing, the Declaration on Planetary Health that the Association of Faculties of Medicine of Canada championed this year, we're launching a commentary in the Lancet that will launch in about an hour, I think, calling for sign-on from across the world. We've already seen huge changes led by health professionals sign on to the call for a fossil fuel non-proliferation treaty last year, led by the Global Climate and Health Alliance, led to the World Health Organization signing on, and the first commitments by countries. And just today, we saw that the European Parliament is ready to put that into law. So imagine what we can do as this mainstreams with a globe's worth of trusted health professionals, really helping people understand that the climate crisis is a health crisis, and the transition away from fossil fuels into a world where we make energy in a way that decreases air pollution, save lives, is the way we can go. We can change this, we can shift markets, we can shift the policies, and I really think we can provide a healthy future for our kids and future generations.
Great, a wonderful note to end on. You're making a difference, and you're going to make a much bigger difference in the days to come. So thank you to our talkers, Kathleen Ross, Courtney Howard, Claudel Desrosiers, Harry Kennard, and Maya Kalogirou. And of course, thank you to the audience for tuning in, for being very enthusiastic in the chat. I know I only got to a fraction of them, but it's great. Thank you to everyone who joined us today for this important conversation. And now I'm going to hand it back to Jen for some closing comments.
Thank you again to you, André, our expert panel. And as you all turn your cameras off, I have to say, it's an event like this, it's hearing from all of you that give me hope. And yes, the audience, thank you for your engagement, your questions and feedback. Fire emojis back at you. What a group. Now, if you enjoyed tonight's event, we have another talk on climate this week. On Thursday, November 23rd, join us at noon Eastern time. So that's a lunch and learn for some of you for Climate Talks, Protecting Biodiversity from the Impacts of Climate Change. COP27 recognized that 3 existential crises, climate change, pollution, and biodiversity loss, are interconnected and can only be solved together. So join the German embassy and consulates in Canada and the Walrus. We come together for a discussion about the lessons and the challenges at the intersection of biodiversity and climate-focused communication in Canada and Europe. And that's what I love about the events, is how we can be in conversation on this truly international issue. So check in with us at the walrus.ca/events. That's where you'll always find our event schedule. You can register for upcoming events. Also, we post videos in the Walrus Talks video room from all of our talks, and we'll be posting videos from tonight there as well. We'll be in touch with you by email, so keep an eye on your inbox. The best way to stay in touch is to opt into our newsletter. The Walrus is celebrating 20 years of storytelling. For 2 decades, the Walrus has been the place for Canadians to go to for beautifully crafted, thought-provoking stories, be they in the form of award-winning journalism, podcasts, or events like this one. And we couldn't do this work without our community support. So help us secure the next 20 years, the future of storytelling. If you enjoyed this free event, consider making a donation at thewalrus.ca/fall donate. That's thewalrus.ca/fall donate. We're in our fall fundraising campaign, and this will help ensure that we can continue to tell Canada's stories now and for many years to come. A few more thank yous. Thank you again to the Canadian Medical Association, the Canadian Nurses Association, and the Canadian Public Health Association for your great work and partnership on this conversation. A big thank you to our annual sponsors as well, Air Canada, Inspire, and Rogers. And thank you all for tuning in and being a part of the Walrus community. Have a great evening.